I just drove out of the Costco parking lot because I can't find parking. The parking situation is a mess, and I'm at Vaughn's right now, and it's a mess here too. It's 11:30 in the morning on a Friday morning, and panic buying continues. To be honest, I got most of my shopping done. I was actually at Costco to get this really good popcorn. I can't find it anywhere else, not even online. But anyway, and also to get some last minute stuff. Some fresh fruits and veggies that will keep your immune system up. And I was speaking with a holistic nutritionist yesterday. She gave me a lot of tips on things to get to keep your immune system up, including echinacea, turmeric, ginger, different oils. But that's not really what I wanted to talk about. I was going to continue my rambling about trying to figure out whether I should stay at work or quit during this pandemic. And well, people are starting to take it really seriously now, I guess, especially now that Disney has closed its doors. Oh, that's when you know it's serious. And so it seems like the public is taking it more seriously. You know, more people are preparing. There's shopping. More schools and businesses are closing down and letting people work from home or take online classes. But I don't know, healthcare workers, are you experiencing the same thing? My hospital still doesn't seem like, I don't feel like we are prepared enough, no matter how prepared our CEO keeps saying we are. We got a letter again yesterday saying we are very prepared. I just don't fucking buy it. I came across this post from a couple of coworkers' Instagram pages this morning, and it describes exactly how I feel as a nurse in California during a pandemic. You know that scene at the end of Titanic when the beautiful music is playing and the ship is sinking? That's what it feels like. You're just helpless and have no idea what to do. You just know it's going to be a sinking ship and you're going down with it. And here's the thing. I'm trying to make the best decision I can as to whether I should jump off of that ship now, while there's a lifeboat there, or do I just ride along with it and see how far I go, and see how long I could tread water and keep myself afloat, especially with the asthma. And it's a rainy day today. I've used my my steroid inhaler, plus I had to use my rescue inhaler, and I still can't seem to catch my breath. I don't know if it's the weather, plus they're doing some they're fixing our floors outside of the hallway where I live, so that's also affecting my breathing. And that's the main thing. I think if I didn't have this lung issue and we had the proper masks and equipment and hazmat suits, I would without a doubt stay on the floor working. And so I knew about this since I've been following it in December and was trying to prepare as much as I can just for this moment. Unfortunately, the government and hospital administrators thought otherwise, and I feel like we're too laid back and not preparing us enough, and now we have to suffer for it. And our very own president could possibly have the virus, but he doesn't want to get tested. Maybe because he doesn't want to find out what the results are. And it seems like that's how a lot of America is handling this. And even in California, I don't even think we are testing. I don't know how to get tested. I've said that in the last few videos. Literally, we have to jump through hoops to get tested. So every day I'm trying to watch the news and see if there's any progress in the state of California, in my city, in our hospital, checking up on emails to see what we're doing to prepare healthcare workers better. And I don't see anything. And I'm just trying to figure out when to give this resignation letter. My friends in other countries who are having the outbreaks are telling me to watch out, because in about 2 weeks we're going to start having a lot of people with it, and it's going to start overwhelming the hospital. I just don't want to leave when that happens. And it's really interesting and scary how fast this virus spreads, because my friend in Spain, she's a nurse, just last week we were talking about preparations and what hospitals are doing to prepare, and she had, I think, only 3 confirmed cases in her hospital, 1 to 3. And just last night she left me a voice message basically saying that they are forcing everybody to stay at home, and that 1,000 new cases were discovered overnight, and that they're now working like 24-hour days as a nurse in the hospitals. They're so short-staffed, and the volume of people coming in is insane. She had vacation requests granted, and they withdrew all of that. So they have no vacations, no rest time, no sick leave. If you've caught the virus, you have to be quarantined for 2 weeks, making it even more short-staffed. So yeah, she warned me to get ready. And I think they have 4,000 confirmed cases now in their city. Also, just last week, she told me that one ICU doctor got infected and attended a meeting filled with ICU doctors, and now all of them are quarantined. That was last week, but they'll be quarantined for 2 weeks. And so that's what we have to look forward to in the healthcare system, with not enough equipment, not enough staff, and just that huge surge of patients. See why I want to leave? It gives me anxiety just to think about being in that position, and yet I'm kind of tied down in a way also, because my health insurance that I so desperately need because of my health conditions is with my hospital. And my cousin, who is a bankrupt attorney, has been posting statistics. Do you know that the #1 reason for homelessness in America is because of medical bills? Yep. And yet I'm hearing about all these layoffs now from different companies. My sister's company laid off 4 people yesterday, and another relative's company laid off quite a few yesterday, and it's ongoing. So yeah, this is just shitty times, and I know everybody's kind of in the same boat. We don't know what to do. I just wish we had better leaders, better preparation. Coulda, woulda, shoulda. And so I'm just rambling so I can hopefully try to figure out if I want to stay in my secure job with the health benefits that I need and helping people out, doing what I love to do, and yet putting myself at risk. And yeah. And maybe the statistics are wrong, and they're saying that people with the lung problems, high blood pressure, and other health conditions that I have, where they say that we have like a 10% or higher mortality rate than most people would. Maybe that's all fake news, and maybe I won't get it, because maybe I'll have a purple bubble of good karma protecting me so that I won't get a virus in those really, really horrendously unsafe conditions. Or maybe I won't have to be on a ventilator relying on a machine to help me breathe. Okay, so here's my wish. After all of this is over, which will probably be in about a year, I wish that governments would prepare more for pandemics. I wish that hospitals had more foresight and prepared more as far as equipment goes, and protective gear, and proper staffing, safer health conditions for healthcare workers. And when I mean safer conditions for healthcare workers, I don't just mean doctors and nurses, which, well, yeah, but I mean, we have like phlebotomists, we have transporters, we have people, dietary people who are there interacting with patients and who can get infected themselves. And You know, it's kind of funny. In high school, I was looking into joining the Army, and my dad really wanted me to, but they wouldn't accept me because of my health problems. And yet here I am. As my friend said, we are soldiers on the front lines, but fuck it, we have no armor, no weapons. We are just, it's a free-for-all. Here, hit me. And we put millions and millions of dollars into other things that I just don't feel like is as important as healthcare. Good. And then even entertainment's important. You know, the singers and actresses and actors that get paid millions of dollars, people in Hollywood, here in California, they get to stay home whenever something like this happens, but we have to figure out how to pay rent and pay our hospital medical bills and figure out how to survive, like literally, when we get sick and have to be in the front lines for this kind of shit. Sorry. Okay, I'm normally a lot more optimistic than this, but this is just it's blowing my mind. Okay, have a great day. Thank you so much for listening to another venting session. And one more thing, actually. There is somebody who commented on Peak Prosperity's video. By the way, Peak Prosperity and Dr. John Campbell were the two people that I learned a lot from regarding this virus. But the person who commented said, our grandparents were called to go to war and we're just being asked to sit on our couches. So please do your part and avoid large crowds. Social distancing, they say, is the key. Just sit at home, watch Netflix, and enjoy your time off of work till we destroy this virus. Also, just passing this along, I'm sure you guys have heard of this. If you guys have the flu-like symptoms, just isolate yourself at home. Do not go to the hospitals. You don't want to be there. Save it for people who can't breathe and are literally like dying. You don't want to be there.